we get to hear from our final journeyer for the moment, and that's Sarity Dodson from Fadalt. Worried I can't see his podium. I might actually sit down. Is that okay?
Um, my beginnings in research were in my training in behavioural science. So I trained as a clinical and health psychologist, and that really started me on the journey of research. The particular training that I did
At Melbourne Uni was very strong on research. So the statistical analysis and research training was a core part of the program throughout my mob journey at Melbourne Uni. I did my honours thesis on the experiences of young people, of adolescents with procedural justice. And then my doctoral thesis was looking at the developmental experiences of people who had type 1 diabetes and who were transitioning from adolescence to adulthood, and the journey that they went through and the experiences that they had trying to manage their disease within the context of the very many things that are going on in their lives. So that I had some great mentors through my early research work, and I also had the great privilege of working with some great collaborators. Particularly, what I learned through those very formative early years was some really strong technical and project management skills that was really drilled in to be, as a young researcher, how important it was to take the time necessary to plan effective research, to manage it, to establish effective partnerships. Many of the things that some of the other speakers have already spoken about. And I also learned through those that I was working with the importance of understanding the patient's experience of healthcare. So I think when I was reflecting as I was preparing this presentation, what some of my key lessons were, I think really what my North Star has been as a researcher through my journey is the importance of really grounding the research that we do in the outcomes that we want to see for people, for patients, and so on. So there can be a lot of research done for its own sake, for academic purposes, but I guess what my North Star is making sure that we invest in research and you take the time to really understand what the experiences of patients are, and ensure that the research really does improve the lives of patients. The other thing that was really important in my early research, so the doctoral thesis that I did involved engaging really deeply with an online community of people living with type 1 diabetes, and this amazing online community, which was quite novel for its time. This was early 2000s. It involved kind of a message board and peer support network that was online, run by two young I think they started the community when they were teenagers, and continued to run it through their joinees. Two really amazing women who are living with type 1 diabetes that recognise the need to bring the community together to support one another, and to advocate for their needs amongst the healthcare providers. And it was one of the early forays in Australia, at least, to really push the agenda of patient-centred care, which is very is spoken about in the eye health world a lot now, but back in the early 2000s was something that was not necessarily on the horizon, that this sector absolutely was in diabetes care and some other areas. So that was really formative for me to really hear from those young people what their experiences are of living with their disease, and what their experiences are engaging with healthcare services, and the sorts of beauties that work well for them as they engage with healthcare, and the sorts of things that ensure that the health system scales their needs. So this is just a feature of the online community forum that was part of that study. And then after my training, after I finished my doctorate, I worked in several community health centres and hospitals as a clinical health psychologist. And invariably, a health psychology service was new. So my work involved not only providing clinical care, but also establishing and promoting that service. And that taught me quite a lot about the ways that the health system operates and how services establish what makes sure that they are effective and high quality and so on. It taught me a lot about service delivery outside of just pure clinical care. And then in parallel to that, I also held positions at the same time at the Department of Health in Victoria, in Australia, as a chronic disease industry advisor, which involved me going out. We had new chronic care policies that were being rolled out by the government, which weren't well understood for health services. So my role involved going out and working with CEOs and healthcare managers and helping them understand what practical changes needed to happen in the way that their services were coordinated and integrated and set up in order that they were effectively meeting the needs of patients with chronic diseases. Um, and I also held ongoing university-based research roles through that period, focused on the experiences of people managing chronic care, chronic conditions, and how services might be improved to meet their needs. So those together, those experiences that I had, both research work and clinical work, helped me to understand the perspective of the patient, the perspective of the health service, but also the policy environment and sorts of things that we need to have in place as an enabling environment to make sure care is delivered effectively. And then later in my career, my interests kind of moved more into health literacy. That became a kind of the latest, I guess, buzzword. And I did quite a lot of research before joining the foundation in the area of health literacy and how we can ensure that people are effectively engaging with the services and the information that they need to manage their health effectively. And then last slide from me. So I joined the foundation 9 years ago now in 2016. And I quickly realized how many of the lessons that I've learned throughout my previous roles were really relevant to eye health. I hadn't worked in eye health before. So it's been a journey to get up to speed with all of the ins and outs of eye health and the sector and clinical aspects of that as well. But many of the things that I had learned in my clinical work and in my policy and research work with chronic disease care were really relevant. So health system strengthening, community engagement, the importance of partnership and advocacy, strategic investments in research, the importance of research translation, and binding to testing solutions were all really relevant to the work that I do at the foundation. And I think, again, sort of picking up on some of the themes that other speakers have noted, I think what kind of, again, the North Star for me, or the few things that I bring into my research work, is ensuring that we are strategically investing in the research work that we do. Research is time-consuming and costly, and the opportunities to kind of waste research is high if you're not careful. So making sure that we are really taking the time that we need to focus in on the right sorts of problems and testing the solutions that we think have a reasonable opportunity of changing people's lives is really, really important. The other thing that is really important is collaboration and coordination amongst various stakeholders. Any one organisation, you're aware, Fred Hollows Foundation is a NGO, but there are many other AGOs and other partners that we need to make sure we're working effectively with in order to have the best outcomes through our research. So that's the other thing that I'm really passionate about, is ensuring that there is cross-organisational collaboration when it comes to research activities. And then, as I said before, making sure that we're always centering, at the end of the day, a beneficiary or patient or community member in what we do, and making sure that whatever it is that we're investing our research time and energy in has the opportunity to change those people's lives in some way. So that's all from me.